The overall goal of the Chronic Disease Management Program is really just to give patients the tools and resources they need to manage their condition independently.
Chronic Disease Management is a team of nurses, health coaches, and myself, the registered dietitian, who work together to help patients and clients who are battling chronic conditions.
Our program is open to patients who have been diagnosed with prediabetes, diabetes, high blood pressure, high cholesterol, or obesity.
Chronic disease management is a multifaceted approach at looking at someone's chronic disease and trying to manage it through lifestyle changes, behavior changes, diet, exercise.
One of our biggest goals when working with patients is to make sure that they really understand their diagnosis. We really just strive to make sure that they have a thorough understanding of what needs to be done and just reassure them that even though they have a chronic condition, they can still live a healthy, normal lifestyle. Most of our interactions with patients are done over the phone or through email. We're also kind of experimenting and exploring with video conferencing. We connect with our patients pretty much based on everyone's individual needs. Some people just need, an email once a week to make sure that they're on track, and sometimes it's 2 or 3 phone calls a week.
Our connection is what is best for them and what I think they might need from a clinical perspective.
We really pride ourselves in being able to meet the needs and communication preferences of any participant or patient who enrolls.
The Chronic Disease Management Program brings together the expertise of our whole team. So anyone who enrolls in the program automatically has access to our nurses, our health coaches, and our registered dietitian.
I work with patients to implement a healthy lifestyle through exercise, nutrition, goal setting.
When I work with a patient, I provide them with health information about, hypertension, for example. And then I can explain to them what hypertension is, how their doctor's treating it, how their medication works, their side effects. Then if I bring in Lindsay, for example, she's a registered dietitian, she can support the patient through proper eating habits.
Everyone has a different starting point, but we work together to make a plan that's going to work for them and to get them to the goals that they're hoping to achieve.
We work very closely in collaboration. We have weekly team meetings where we kind of discuss our patients together and figure out if there's something that we could be doing better, and if so, we can pull in one of the other team members very seamlessly.
At ConnectCare3, for a patient to get started, we want to make this as easy as possible.
A patient just needs to reach out to ConnectCare3. They'll first speak with one of our patient advocates who will do a brief intake assessment with them, find out what qualifying conditions they have, and then they'll receive an email with a consent form. The consent form's super easy to fill out. It should only take about 5 minutes. And then once we receive that form, I would get notified and decide who on the team is the most appropriate person to work with. And then from there, within 1 to 2 business days, the chronic disease management team will reach out to you directly.
One thing that really sets our chronic disease management program apart is our individualized nature.
When patients reach out to the chronic disease management program, some people have already taken the steps to really gain control of their chronic condition, whereas other people just don't even know where to start. So our team tailors our program to meet each person where they are.
Every person is different, so they all have different needs. And as you work with each person, you can identify their strengths, you can identify their weaknesses. You can see where they need more support.
Really trying to understand their lifestyle, understand their disease, and most importantly, understand how their disease is impacting their lifestyle.
Goal setting in the chronic disease management program is essential because with each coaching session, we want you to have a takeaway and we want to be able to see and measure progress.
Accountability is important for folks managing a chronic disease because it sets them up for success. As a health coach, as a nurse, we're saying, what were your successes this week?
The most rewarding part of my position in the chronic disease management program is being able to work with patients directly and help them gain the confidence they need to control their chronic condition.
Being a part of people discovering that they have a choice over their health and about their health care.
The most rewarding part of my job is getting to see a client reach a goal.
Seeing the transformation that lifestyle change can bring.
For patients who are feeling overwhelmed or just kind of lost in the maze of the healthcare shuffle, my biggest kind of takeaway is that you're not alone.
Well, managing a chronic disease is not easy, and we would love to help you.
We're real people who are available to you.
Our team is here to support you and make sure that you have the tools and resources needed to be successful.
Patients can enroll in the Chronic Disease Management Program by calling ConnectCare3 or sending us an email at info@connectcare3.com.
call us. Call us.